In the 1950s, the FDA had approved 700 different ingredients in our food products. That's it, 700. Today, there are over 10,000 chemicals and petrochemicals in our food products in the United States. In Europe, still 700.
Jesus.
And what gets crazier is when Food Babe, she's an influencer, right? And that's been, crapped on by the media.
It's an unfortunate name, Food Babe.
Yeah. But she's an advocate, and she's just a voice, a mother out there saying, hey, guys, what's wrong with this picture? Let me show you what's in Fruit Loops in America, and let me show you what's in Fruit Loops in Canada. The same manufacturer, Kellogg's, is selling one product to the American people and a safer, less ingredient, less chemical-filled product outside the United States. They have the ability to sell it here, but they don't because they know they can sell more addictive, more colorful, vibrant, that attract kid food sources here in the U.S.
It's so dark.
And so we walked through all of that. It blew my mind on the food front. And we know, you and I have talked, like in the healthcare system, my main message was, we're here to talk about the boom in chronic disease. We know that food and our environment has a huge impact on that. But so does preventative care. And so does building an ecosystem that allows clinicians to troubleshoot and diagnose and prevent chronic diseases from evolving in the first place. These are all metabolically related disease states. All the chronic diseases that are killing us can be traced back to diet, lifestyle, and nutrition, but none of our clinicians are trained on diet, lifestyle, and nutrition.
That's the hard pill for people to swallow. Diet, lifestyle, and nutrition. It's very hard for people who are addicted to shitty food, who are lazy, who don't have a history of exercise, and their lifestyle sucks, and they get home from work and they like to drink.
Yep.
Like all those things are killing you.
Yeah.
Yeah.
But you and I have talked about this with some of your comedy friends that have become my friends too, to watch the evolution. You just got to give people momentum. We just got to get some wins on the board. We got to give them hope. Mm-hmm. And we've got to start by having the conversation. And that's what I was optimistic about. For the first time in my adult life, the Senate is willing to sit down with a group of individuals and have a deep conversation about where our food comes from, how our food is being processed, what ingredients are in our food, and how that could potentially lead to chronic disease. And it got labeled by some of the, I would say, hatchet job media outlets that have come out, and we can dive into that. Somebody called it the woo-woo.
Yeah, I saw that. Yeah. Let's dive into it. First of all, fuck you, whoever wrote that, because there's nothing woo-woo about anything you guys were saying.
Yeah.
That's what's really crazy.
Yeah.
To say that toxic chemicals that are illegal in other countries but are legal in the United States, and there's a reason why they're illegal. You could find all the different things that they do to the body, all the different damage they cause. To say that that's woo-woo is so crazy. Like, what did they list as an example of woo-woo?
What's hard is they went immediately at, like, these are all entrepreneurs that have something to sell you. And I can tell you, sitting in the room with those people, all of us were scared. All of us were scared. It's scary. I'm not going to make money off of this. If anything, I could lose money. I have businesses that are under the FDA's guidelines, are under the FDA's oversights. I don't want to upset the apple cart, but I also want to tell the truth. And I wanted to share what I saw, and that was my message was, I'm not here to represent the left or the right. I'm here to represent humanity. This is not a Republican issue. This is not a Democrat issue. This is a humanity issue. These are people's lives.
But it's just stunning that people are willing to whore themselves out to write a hit piece on someone trying to help human beings find healthier choices and realize the root cause of all the diseases that we're facing.
The woo-woo article, she alludes to how we talked about nothing but metabolic disease. And what does metabolic disease have to do with cancer? Well, actually, I can tell you, it is the number one risk factor. Obesity and metabolic disease is the number one risk factor to all forms of cancer other than smoking. So if you take smoking and age out of the equation, it's your number one risk factor. That's what it has to do with it.
Imagine that statement. What does metabolic health have to do with these diseases? That is so crazy.
And the people on that panel, too, to their credit, I was the least qualified of anyone to be in that room, and I was there to talk about my experiences as an industry insider. I am not telling you that I am an expert on metabolic disease. I can tell you that I'm an expert on fuckery because I've been in healthcare long enough to see what they're doing, and I know their equation. I know their offense. But other than me, you had Casey Means, Stanford-trained surgeon. You had Dr. Palmer, a psychiatrist from Harvard, who was breaking down metabolic disease and how it's astronomically impacting the mental health crisis in America. One of the stats he dropped on us in his testimony was we are at an all-time high in suicide and death of despair, greater than during the Great Depression. More Americans are dying of suicide and death of despair more than ever. More children are being diagnosed with metabolic disease, diabetes. Girls are starting periods 6 years younger. Like, I don't need a double-blind study to tell you something's wrong. Just look at the data. And that was this message.
I'm hearing a lot of woo-woo from you. Yeah. I need some data.
It's like, as we get into that, in the names, they just totally breezed over, and that article tried to make it sound like it's a bunch of influencers. And it's like, yes, there were some people who have social media presences, but there were also academics there.
But also, you can't
Harvard,
dismiss,
Stanford, and Stedman Hawkins.
You can't dismiss someone who's giving out factual information because they're a so-called influencer. Some people get into influencing for a good cause.
100%.
And they have real valid information, and they collect that valid information and distribute it, and that's how they get a following.
And you know, even Vonnie is the food babe. Vonnie, her battle has helped remove ingredients from certain states, stop chemicals in certain food sources. They're actually going to march to Kellogg on the 10th of next month to hand a petition signed by over 100,000 Americans coming out the tail end of that, asking them to remove dangerous chemicals that they don't put in food products in other countries and just match it. That's all they were asking. Hey, why don't we just match what you're doing outside the U.S. and all these other countries where they've said these products aren't safe? Why are we allowing you a mulligan on the U.S. population when it comes to food? And they've never been studied. That's the other wild thing. The FDA doesn't have the bandwidth to study every time a new ingredient's added to a food source.